Hi, this is Jeevaratnam and welcome to my channel Jeevan Astro Answers. And this topic is about spleen enlargement, that is splenomegaly. The spleen is part of our body's lymphatic system. The lymphatic system helps remove cellular waste, maintain fluid balance, and it fights the infections. The spleen also responsible for making substances that play an important role in inflammation and healing. The spleen sits in the upper left part of our abdomen. It's located behind the ribs, under the diaphragm, and above and behind the stomach. This fist-shaped oblong organ is purple and it weighs between 2.5 to 7 ounces in healthy individuals. It can become significantly larger when a person is sick or injured. The spleen performs several critical jobs such as filtering out, destroying, and recycling old, damaged blood cells. It stores red blood cells and platelets, which help the blood clotting mechanism. The spleen plays an important role in the immune system response. When it detects bacteria, viruses, or other germs in the blood, it produces white blood cells called lymphocytes to fight off the infections. But an enlarged spleen affects each of these jobs. Many conditions, including infections, liver disease, and some cancers, can cause an enlarged spleen. An enlarged spleen is also known as splenomegaly. When it's enlarged, the spleen may not function as usual. Some of the common causes for splenomegaly are viral infections such as mononucleosis, bacterial infections such as syphilis or an infection of the heart's inner lining, that is endocarditis, parasitic infections such as malaria, cirrhosis and other diseases affecting the liver. Blood cancers such as leukemia and lymphomas such as Hodgkin's disease. Various types of hemolytic anemia. Metabolic disorders such as Gaucher's disease and Niemann-Pick's disease. Pressure on the veins in the spleen or liver. Blood clot in the veins. Autoimmune conditions are some of the conditions that is responsible for enlarged spleen. An enlarged spleen typically causes no signs or symptoms, but sometimes it causes pain or fullness in the upper belly. A feeling of fullness without eating or after eating a small amount because the spleen is pressing on the stomach. Low red blood cells, that is anemia. Frequent infections. Bleeding easily. Now we see the planetary combinations for enlarged spleen. Moon and Lagna Lord aspected by a malefic without benefic aspect. Lagna Lord and 7th Lord aspected by a malefic without benefic aspect. Certain 4th house or in 7th house aspected by a malefic. Certain in Lagna aspected by a malefic. The Sun in Capricorn. For Aquarius Lagna, the Moon aspected by malefics. Mars in Lagna with the weak 6th Lord. Sun in Lagna aspected by Mars. Suppose any of this planetary combination got afflicted, it may lead to splenomegaly. But some medical medications, certain drugs such as antibiotics may be used to treat any underlying concerns that could be causing the enlarged spleen. Changing diet and lifestyle patterns such as eating plenty of nutrient-dense foods, limiting the sodium intake and getting regular physical activity may help improve certain conditions that can trigger spleen concerns. In severe cases, especially if the enlarged spleen is causing serious complications, then spleen removal may be suggested. There are also several ways to prevent an enlarged spleen, such as by avoiding infections or injuries that could damage it. And some of the tips are: don't share your personal items like silverware, toothbrushes, or drinks with other people. If you play football or other contact sports, wear safety gear, including padding, to help protect your spleen and other organs from injury. Drink alcohol in moderation. Always use a condom to avoid sexually transmitted infections. Always wear the seat belt when driving the car. Finally, if these health challenges enter in anyone's life, don't get panic and face with cheerful, because cheerfulness is the best promoter of health and is as friendly to the mind as to the body. So take care and have a nice day. Meet you soon all. Bye.